Aseptic Skin Preparation for the Surgical Patient by Stephanie Beckman at Aspen University. The primary topic of this presentation addresses the proper methods for preparing of skin of surgical patients in the operating room prior to the first incision being made. Once the patient is asleep and prior to the first cut being made, it is the nurse's responsibility to prepare the skin for the sterile procedure. This presentation will address the evidence-based practices involved in performing a proper preparation of the skin, ultimately providing a more sterile and safe situation for the patient and decreasing their risk for surgical site contamination and infections. Introduction. The purpose of this presentation is to present the evidence-based knowledge which has contributed to the necessary changes that must be made in regards to the skin preparation of surgical patients prior to surgery. This evidence-based knowledge will serve as the foundation for the changes in nursing practice that will be implemented within the operating room from this point forward. Objectives. In this presentation, I will begin by comparing theory, research, and practice in nursing between two separate scholarly peer-reviewed articles regarding the topic of skin preparation for surgical patients. This presentation will also discuss the theory that best relates to the proposed evidence-based practice that will be implemented as a result of this research. I will compare and contrast qualitative and quantitative research articles regarding the topic and discuss philosophical, theoretical, and methodological perspectives which present as evident within select articles. I will conclude by discussing any ethical and scientific integrity issues that may arise in the conduction of research regarding this topic. Two scholarly articles. The first article I will discuss is titled Skin Preparation of the Patient More Than Skin Deep. We will call this article Article 1 in this section of the presentation. The second article that will be discussed in comparison to Article 1 is titled Skin Preparation for the Prevention of Surgical Site Infection, Which Agent is Best? We will refer to this as Article 2 throughout the remainder of this section. Comparing theory. Article 1 specifically mentions Hippocrates' concept of medical harm as a primary theory relevant to the implementation of best practices related to surgical site infection preparation. The article further expands on this statement by mentioning that in a recently conducted study consisting of 5,439 instances of skin preparation, it has been observed that there was significant variation in skin preparation practice among healthcare professionals. This drastic variation in practice implies a significant lack of compliance to evidence-based standards for preoperative skin preparation. Practices noted as varying between facilities and healthcare professionals include practices including but not limited to the application of skin antiseptic without sterile gloves and lack of performing the recommended central to periphery technique. By not adhering to these standard practices for skin preparation in the operating room, healthcare professionals are ultimately placing their patients at risk for medical harm. Article 2 simply discusses practice guidelines and implies that lack of adhering to these guidelines is the only explanation for the poor surgical outcomes in surgical site infections. This type of article presents a theory described as being a practice theory, and This type of article presents a theory described as being a practice theory. One article describes practice theories as being theories which have very limited scope and explore only one particular situation found in nursing practice. Because this article describes only concrete information related to the topic, it can be determined as a practice theory. Comparing research. Article 1 states that while many preventative measures exist in the realm of eliminating risk for surgical site infection by performing proper skin preparation prior to surgery, evidence continues to support the fact that more needs to be done to improve perioperative practice, education for medical professionals and facilities where surgical patients are being treated. This article evaluated a total of 5,439 events of recorded skin preparation and concluded that one of the biggest issues in these cases was the fact that so many facilities carried out their preoperative skin preparation routine so differently. As previously stated, this variation in practice is a huge contributor to poor surgical outcomes related to skin preparation. Article 2 addresses different types of skin preparation solutions and evaluates their effectiveness when compared to one another. One study, which evaluated 3,209 general surgical procedures, compared the use of 3 different skin preparation solutions. Skin prep solutions evaluated in this study included a povidone iodine scrub paint combination with an isopropyl alcohol application being utilized between the steps. Each of these solutions were utilized for a 6-month period for every general surgery case, and surgical sites were monitored and evaluated for signs of infection for 30 days following the procedure. Results of this research study concluded that DuraPrep solution resulted in the lowest instance of surgical site infections within this 30-day time frame, with only a 3.9% infection rate. Betadine cases resulted in a 6.4% infection rate, and ChloraPrep resulted in a 7.1% infection rate. Article 1 implies that the key to best practice when it comes to safely preparing the skin of the surgical area for the procedure lies in compliance to evidence-based standards. This article implies that by providing operating room staff with the proper knowledge regarding evidence-based standards and guidelines and ensuring staff compliance to these standards, the occurrence of surgical site infections is likely to diminish. Article 2 states that preventing surgical site infections postoperatively relies on what type of skin preparation solution is being utilized. The practice stated as being the best for eliminating the risk of postoperative surgical site infections, according to this article, is the utilizing of DuraPrep solution as the preoperative skin prep. Proposed changes that I would like to make in regards to the skin preparation of surgical sites in order to decrease postoperative infection risk include staff education of current evidence-based practices, the usage of DuraPrep skin solution, and the proper use of DuraPrep solution, including allowing it to dry for an intended period of time, etc. Theory behind the change. The previously mentioned article, Skin Preparation of the Patient More Than Skin Deep, refers to Hippocrates' concept of medical harm as being a primary theory relevant to the implementation of best practices related to surgical site preparation. The article states that by not adhering to standard practices for skin preparation in the operating room, healthcare professionals are ultimately placing their patients at risk for medical harm. Quantitative and qualitative articles. One article that I found in relation to surgical skin prep, which presented excellent quantitative data, is an article called Chlorhexidine Provides Superior Skin Decontamination in Foot and Ankle Surgery, a prospective randomized study. For the purpose of this study, patients with intact, unaffected skin who were scheduled to have clean elective foot surgery and foot and ankle surgery were prospectively enrolled and randomly assigned to skin preparation with either povidone iodine in Group 1 or chlorhexidine scrub and isopropyl alcohol paint in Group 2. A total of 127 participants were enrolled in this study. Participant age ranged between 16 and 85 years with a mean age of 46. 67 participants were assigned to Group 1 and 60 participants assigned to Group 2. In Group 1, 53 of the 67 patients, a total of 79%, had positive culture results, and in Group 2, 23 of the 60 patients, 38%, had positive culture results. The results of the study indicate that chlorhexidine and alcohol provide a better reduction in bacterial carriage than povidone iodine, ultimately recommending the use of chlorhexidine and alcohol as a primary surgical skin preparation solution. An article that presents great research and information regarding surgical site preparation comes from an article titled Importance of Alcohol and Skin Preparation Protocols. This article presents its finding through qualitative report and stresses the importance of utilizing alcohol during surgical skin preparation. The foundation of the concepts presented within this report originated from an idea mentioned in the New England Journal of Medicine in 2010, which stated that a lower incidence of surgical site infections was directly correlated to the usage of alcohol in conjunction with a standard skin preparation solution. The article goes on to mention that despite distinct differences in surgical site skin preparation protocols, the rapid bactericidal properties of alcohol may prove to be a crucial part of any surgical site preparation regimen. These two articles differ in many of the obvious ways that qualitative and quantitative reports generally differ. For example, our quantitative article mentions a specific study which was performed and reports statistics and numerical data in order to make the point that chlorhexidine and alcohol proves to be the most effective primary surgical skin preparation solution in the prevention of surgical site infections. The qualitative article that is discussed, on the other hand, presents more of a knowledge-based hypothesis which aims to improve practice. The qualitative article presents logical reasoning and scientific evidence that supports the idea that the utilization of alcohol along with standard surgical skin preparation significantly decreases infection risk due to its rapid bactericidal activity. The articles are both similar in the fact that they both recommend a solution that have determined that have been determined as being the best for preoperative skin preparation. Additionally, both articles utilize previous research as a foundation to build and continue research and knowledge in the topic of skin preparation. Obtaining research via technology. In the process of locating the articles that I have been used for the purpose of this presentation, a variety of online resources were utilized. The two databases that I have used to retrieve these articles were PubMed and ProQuest Central. When searching for information regarding proper skin preparation of surgical patients, I used key terms such as skin preparation, sterile, surgery, and evidence-based to ensure that I was getting relevant and accurate search results. Perspectives. A philosophical perspective that was presented in all discussed articles is that of realism. Because these articles, like many research studies, discuss facts and only objective aspects of reality, it makes each of their philosophical perspectives come from that of a realistic standpoint. Each article is based on research and concrete perspectives, making realism prevalent in each study. The common theoretical perspective that has been presented in these articles is that there is certain solutions that are more effective in preparing the skin for surgery and ultimately diminishing patient risk for developing surgical site infections. Each article mentions in this presentation presents different research and studies to support this common theoretical perspective. An example of methodological perspective that was presented specifically in the article Skin Preparation of the Patient More Than Skin Deep is that of facilities and medical professionals adhered. If facilities and medical professionals adhered strictly to all implemented standards and eliminated variance in practice, then it can be assumed that a majority of surgical site infections can be avoided regardless of the solution that's being used. Ethical issues and considerations. Perhaps the most relevant ethical issue related to the conduction of research involved in this topic is the issue of beneficence. At the beginning of this presentation, we mentioned an article called Skin Preparation of the Patient More Than Skin Deep, which presents an obvious implication of the theory of medical harm famously discussed by Hippocrates. This concept directly relates to the ethical issue of beneficence because beneficence states that as a medical professional caring for patients, you will do nothing to harm them or put them at risk for harm. However, by utilizing less effective solutions as skin prep in order to provide comparisons in research, it can create a thin line between conducting safe research and blatantly disregarding ethical concept of beneficence. In order to avoid an issue with beneficence and other ethical concepts, informed consent is necessary to obtain from all patients. Prior to obtaining consent from participants, each individual must be fully informed of the risks and benefits of each being involved and what exactly their role is and involvement consists of. It is only after the participant is fully understanding and accepting of their role as a research participant that consent can be obtained. Nursing knowledge. My nursing knowledge advanced in a number of ways through the utilization of research. One way I felt that my nursing knowledge advanced was in the accumulation of reliable resources. I have learned how to distinguish between reliable, scholarly resources and resources that only appear to be as such. In understanding this distinct difference, I have been able to expand my knowledge of reputable evidence-based research and practice. Another way in which my nursing knowledge has advanced through the utilization of research lies in knowing how to compare available information. I have learned how to take different articles of similar topics and determine similarities and differences between them and distinguish whether those differences are as a result of the conduction of the study that was performed or a difference in results in general. I have also learned to determine appropriate methods of conducting research and understand how to determine this in research articles that I read. Finally, my nursing knowledge has advanced in the realm of ethics and research due to my newfound understanding of the role that ethics play in the conduction of the research itself. This presentation, in conclusion, has presented to the audience the evidence-based knowledge which has contributed to the changes that are being made in regards to the skin preparation of surgical patients prior to surgery. This evidence-based knowledge has served as the foundation for these changes in nursing practice and will be utilized in the implementation of current evidence-based practice in the operating room from this point forward. These are the references that I used for the purpose of this assignment. Thank you for listening, and I appreciate your time.